What is the difference between CRION versus recurring optic neuritis? What are the MOGAD patients more likely to present with?
That's a very good question. So CRION stands for chronic relapsing inflammatory optic neuropathy. Essentially there you've got an optic neuritis that will present like any other optic neuritis, but it's very steroid dependent and often very, where when you come off the steroid, you have a relapse. So again, it's steroid dependent. With relapsing optic neuritis, you can have an optic neuritis attack, and then you can come off the steroids and you actually can do well for a while, and maybe 1 or 2 years later, you've got another optic neuritis. So that's where I put relapsing optic neuritis, as opposed to CRION, where you're steroid dependent, you essentially have an optic neuritis, you treat with steroids, it goes away. The second you come off steroids, it comes back. That's where I kind of make that distinction. And in terms of MOGAD patients, they can present with relapsing optic neuritis, where you have an attack 1 year and an attack 3 years later. But some patients can be steroid dependent, where you have an attack, you treat with steroids, they get back to 20/20, you come off steroids, and boom, it's back again. And then they kind of fall in that CRION category. It can go either way for those patients.
Yes, I would absolutely agree. I think that MOGAD patients can have either form, but we know that MOGAD is very steroid sensitive. And so that's something that as a practitioner I've seen, especially in children with MOGAD, that as you start to taper down off the steroids, there might be a worsening of their optic neuritis or even a recurrence. And so I think these terminologies, they probably need a little bit more fine-tuning, and especially as definitions are being developed for MOGAD, this is where I think we need to continue to do some work.
Yeah, it's actually very interesting because CRION is this kind of umbrella term. And we didn't know about MOGAD before. And now we're realizing that about half of CRION was actually MOGAD. And so, we're still chipping away at this kind of umbrella term of CRION. And we know that MOGAD is a very common cause of it.
And Dr. Chen? Oh, go ahead, Dr. Randall.
I just wanted to make a comment because I think as a pediatric provider, we think very seriously about steroids in children, as we do in adults. But chronic exposure to corticosteroids influences your growth, bone health, muscle health, body habitus, skin integrity. And so I think a very important future research question is in those children or adults that appear to be steroid responsive, can we actually intervene earlier with something else that would supplant the steroids and get them in a situation where they're not having relapses, but they're also not on chronic steroids?